All right, on to our next story. A good portion of Maine's immigrants cannot afford to go for a simple checkup at the doctor. Many ineligible for Maine-Care or the Children's Health Insurance Program because of their immigration status.
News Center Maine's Hannah Yashivi reports that there is a bill moving through the state legislature right now that, if passed, would change that.
Gladys Diaz came to Maine from Ecuador. She and her family have been here for 14 years. 4 of those years packing lobsters.
Pero por cuestión de mis documentos, ya no pude seguir trabajando, entonces ahora cuido niños en casa.
Gladys is not a legal U.S. citizen. She says access to health care is basically non-existent to her family.
Es bien preocupante porque cuando uno se enferma, uno no acude a los médicos pues por el bill que le va a venir. Entonces lo que hace uno en casa es hacer medicinas naturales.
Many of Maine's immigrants work in our blueberry fields or at our construction sites.
All the things that we depend on for our state to thrive, and people can't take their families to the doctor. So
Crystal Cron works to empower the Latinx community in Maine. She testified to the state legislature's Health and Human Services Committee in favor of a bill to extend health care to everyone, regardless of their immigration status.
Our state denies them their most basic human right, the right to health and to life.
The committee voted Wednesday to advance the bill by a 7-4 vote.
This is a program that was in place since 1990s, and during the LePage administration in 2011, he ended it.
Lewiston Representative Margaret Craven voted in favor to reinstate it.
The Republicans voted against it, and the reason they gave was that we should take care of our own first. And I'm thinking, they are ours. We want them to stay here because we have a real labor shortage.
We've seen time and again that Mainers have chosen to say, we want more health care for people. And this is another step towards that.
A step that will make sure everyone has affordable health care in Maine. Hannah Yashivi, News Center, Maine.
Now, this bill is expected to be voted on by the House and Senate when they meet next week. If they pass, it still has to go through appropriations to see if it gets funded. It is projected to cost $5 to $7 million per year.